Good afternoon, everyone, and welcome to another episode of Sunday Housecall. We hope that you had a wonderful week, and we're here again bringing you one of the best medical information and education for you. As usual, a lot of these topics that we talk about, it's not necessarily for you because we don't know you as an individual, but it's for the public, and you always have to talk to your doctor to make sure that these advices are appropriate for yourself. We're very honored to have a very special guest today. Dr. Sean McCance is with us, and this is based on the request of a lot of people out there who wanted to hear about back pain. And questions about lower back pain and neck pain is what we're going to be talking about. The treatment options, some of the medical treatment and surgical options that are available, and we couldn't think of anybody else who's more qualified in this field. This is the man who has operated on over 5,000 spine surgery. It's a successful outcome. I personally know him and his work ethics for over a decade. We've rounded early in the morning at 5 a.m. and we've left the hospital at almost midnight. So I know he's a very hardworking, great surgeon, and it's someone that I would send my own family members to him, and that's why I wanted him on this show. Sean, welcome to the program, and we hope that we learn a lot from you.
Thanks so much.
So, you know, we're talking about obviously back pain. And as you know, millions of Americans are suffering from this. Yeah. This is one of the leading causes of disability in this country, and so many people actually go to doctors as a result of this. It's the leading cause of disability, and almost 8 out of 10 Americans are suffering from back pain. Why so much? Tell us about some of the reasons and risk factors and everything we need to know about back pain.
Sure. Well, it's a great question, and it is, a huge general population issue. Back pain can arise for multiple reasons. We have a very sedentary lifestyle at this point. Everyone's working in offices, everyone's on their iPad, people are losing core strength, posture's affected. As you get older, your muscles weaken. And if you're not active, if you don't maintain a good core, if you don't maintain good muscle strength and posture, you can predispose to back pain. That's certainly one major issue in the public.
I think probably the way we're structured, and you have actually the whole image and the prop for about the spine. Maybe you can show us the way. Understand this building. Maybe you can show us the actual spine. The way this was like really set up is for us to be standing, and because of all this technology and the iPads and the fact that we're sitting behind computers for years, the pressure on these discs and the inflammation that they cause, is that part of it? Maybe you can demonstrate exactly what we're talking about here.
Well, the way the spine is designed to work, you have something called lordosis and kyphosis, which are the normal curve of the spine to keep us upright. And with slouching and leaning forward, that puts enormous tension on the muscles on the back. So all these muscles are now fighting to pull you back. And if you have bad posture and you end up like this, you put enormous strain on this whole area. This happens when you're sitting hunched over a computer all day or exhibiting poor posture. Your muscles have to work harder, the joints in the back become inflamed, and also when you flex forward, you're putting more load on the discs, and they can become inflamed.
By the way, I have that same problem as you just discussed, because as you know, as a robotic surgeon, I sit behind the robot, and you're constantly leaning over, and I can tell you that by 5, 6 o'clock, I have tremendous pain in the lower back, so I can totally relate to this.
Right.
And what do you do to avoid it? Is it certain, I know the posture has to be in a good position, but is there certain chairs or certain things I can do in order to be more comfortable?
Well, ideally, we're designed to be like this. That allows the normal mechanics of the spine to function between the posterior and the front, the back and the front of the spine, so you sit in a neutral alignment. So having the proper height, getting up every half an hour and walking around, changing your position, adjusting your desk height, adjusting your computer height, all these things can allow you to get into that better posture and avoid the wear and tear that you're talking about as the day goes on.
Now, when you look at the spine like this, even though we don't see a lot of the structures, Sean, there's a lot of ligaments and muscles and nerves and bones involved in this.
Exactly.
So what happens? Is it a muscular pain? I mean, as a urologist, I see a lot of people coming in saying, I may have a kidney stone, I have this back pain, and it's always like kidney stone that comes to their mind. But is it mostly ligament issue? Is it like the disc? Is it muscle?
It's a combination. You know, if you go out on the weekend, let's say, and do a little extra exercise and you flex forward and lift something the wrong way, you could strain all the ligaments that are between these bones. And that little ligament tear can be extremely painful. That pain typically lasts a few days to a week or two. It gets better with Motrin or Advil. Or the chronic tension of the bad posture is muscle. But then a huge driver of back pain is the disc. Somewhat as you get older, after age 30, 40, the disc starts to degenerate. The discs, as you can see here, they're like shock absorbers.
Where
like
are
tires
these
on a
discs
car,
located?
in the front of the spine.
Okay.
They're the major weight-bearing part of the spine. I often tell patients they're like tires on a car or a shock absorber. And if you get a flat tire, the air goes out of the tire, it becomes weak, and it can't take load. As the disc becomes weak, it becomes inflamed, and that in and of itself becomes a huge source of pain.
So somebody asked me online, I take calcium and I take my vitamin Ds. Is that going to help me with delaying some of this disc generation? That's calcium or any of this?
So calcium and vitamin D is very important for bone health and avoiding osteoporosis. It does nothing to do with disc degeneration or muscle tension or muscle inflammation.
So how do you slow that process down? Now maybe we can, if you have an image of herniated disc, that's a term that a lot of people know about herniated disc. And you go and you see the doctor and they say like, oh, your disc is herniated. What does it really mean when somebody has a herniated disc? Is that?
So you see the picture on the screen. A herniated disc is when a piece of the disc actually pops out of the normal disc space and goes into the spinal canal and hits a nerve. The analogy of squeezing a jelly donut and the jelly squirts out is very much what happens. And the piece of disc that pops out is actually a firm rubbery material, and it sits on the nerve, and that causes sciatica, which is pain down the leg. And again, it's a very common issue that can occur oftentimes after heavy lifting or the wrong exercise, but sometimes it just occurs with normal wear and tear.
Now, you also have like the whole pelvis bone over here. This is obviously the sacrum, and then you have the SI joint here.
Right.
Where is this sciatic nerve, and is it a positional issue because you're basically pressing on where that nerve is? I'll tell you some of the problem that I have. Sometimes, I sit on my wallet, and as surgeons, sometimes you put your wallet in your back, and it presses on that nerve.
Right.
And I fixed the problem. I just basically switched it to my pocket, and now that went away. Was that real, or is that?
That is real.
Trauma is real, that area?
So the pelvis and the spine sits on the pelvis. The major sciatic nerve comes out through this notch called the sciatic notch and runs down the leg. So if you pressurize that, you sit on a hard surface as you described, you can put pressure on that nerve and get a tingling or a pain down your leg. So that's common. Other causes of sciatica, the pelvis and the sacrum form the SI joint. This is another huge area that can cause buttock pain and leg pain, sacroiliac joint arthritis or inflammation, because this joint actually moves between the spine and the pelvis.
Now, even though we know these back pains are very common, when do you really get concerned? If somebody is watching the program right now and they say, okay, so what? So I took some Motrin, I feel better, or I went to some massage and got some heat pad or cold treatment, and it got better. When would you be concerned? Are they doing the right thing? Can someone who doesn't know what they're doing, they can massage it and make it even worse? Is it something like tingling feeling is a big red flag for someone like you? What do you tell people out there?
So most back pain that's benign, back pain that's muscular inflammation, will get better over the course of 2 weeks, 4 weeks, 6 weeks with Motrin, massage, physical therapy, chiropractic, swimming, yoga, Pilates. There's lots of things out there. People should start to get concerned after 3 months or so when the back pain is not getting better or getting worse. That would indicate there's more of a structural issue underlying the back pain that might need evaluation with an MRI, x-rays, evaluation by a specialist. After 3 months, if the pain is continuing, we consider it more chronic and needs to be evaluated. Also, as you pointed out, sometimes back problems will lead to more neurological issues, weakness down the leg, numbness down the leg, difficulty walking, drop foot, even trouble with bowel and bladder function. And if that occurs, that definitely prompts imaging, MRI, evaluation by a specialist.
Okay, so there are a lot of herbals and there's a lot of medications that they can take before they jump into a major operation, I assume. Now, do you send your patient to a chiropractor or physical therapist?
So I think both chiropractic and physical therapy have their roles. The chiropractic, if you have a skilled chiropractor, you have techniques such as active release therapy, which is a deep tissue technique that can very quickly release spasm and is a very powerful focal treatment. Physical therapy takes more of a longer term approach, postural, muscle strengthening, stretching, exercises you can do at home. So I think there are 1-2 type attack on the back pain. If I myself have had severe back pain twice that lasted a short period of time. I went to the chiropractor, got a deep pressure manipulation, and was amazed. I felt 70% better when I got off the table. And then physical therapy is better for the longer term rehab. But I think both of them are valuable.
It's funny, I had the same exact problem actually about a week ago. Made the wrong turn and the muscle went, and by just pulling that, it was miserable. I mean, it's amazing how difficult it is to move around once you have that. Want to talk to you also about obesity. We had Adam Rosenbluth here. We talked about high blood pressure and obesity. And I think obesity also has a lot to do with some of the back pain, because this spine, as you mentioned, it's not meant to carry all that weight. And by just that weight, it probably presses a lot on those vertebrae and the muscles, right?
Yes. Yeah, well, so if you're carrying more weight, and particularly if you're carrying more weight in the front and you're leaning forward, that's more weight that's loading your discs, loading your nerves. Also, women with very large breasts, oftentimes the weight of that will cause back pain and thoracic pain, and they will get a breast reduction, and that actually helps the back pain.
That's mostly neck pain, right?
Neck and thoracic.
I see.
So any weight that's in front and you're carrying puts more strain on the spine. And another interesting fact is any weight that you're putting in front of you, the further it is in front of you, the more weight is transmitted to the spine by a factor of 3 because of the distance. So it's magnified. Here you hold a weight, there's almost no effort on the spine. You put that weight out here, it's an enormous magnification.
So I think from what I hear is lose the weight, certainly exercise, and that all that sedentary life, even if you have to get up for a few minutes and walk around, put the computer down and make sure that you walk around. The stretching is also important. Are there any stretches that you recommend to your patients, movements, things that you can do right at work, in the middle of the day by twisting and turning and certain easy steps that you can relieve some of those stress?
Sure. I mean, just moving around and changing position is good. Bending forward, reaching for the toes. When people have chronic back pain, a lot of times the lower back and the buttock and hamstring all gets very tight. You can lean down, reach for your toes. That helps that. One very good stretch if you're having acute back spasm is actually lie on the floor, use your arms and press up. It's called the cobra. Push up, and that actually is very effective for relieving acute back pain.
How would that work? So basically you're reversing.
So you're lying on the floor.
Right.
You're pressing up, and that does this, and it relaxes all those muscles. It also helps to reload the facet joints in the back by compressing them, and that re-engages them in your spine. So it's actually a very effective exercise to release or relieve acute back spasm.
Good. What's your most favorite anti-inflammatory over-the-counter that you recommend?
I think Aleve works very well.
Aleve is the one that you like.
Yep.
Okay. So we actually have a question. Before you came, I talked about all social media that you were coming, and we have a live question that came to us from, I believe Mary was her name, and she writes, I fractured lumbar 1 in 2014. The pain is not constant, but it's painful every day during normal course. Would the 1-inch surgery help me at all? What is 1-inch surgery, and what do we tell Mary? Should she go for this, or are there things that she can do to help her?
Right, so a 1-inch surgery is a small microsurgery. Typically that's a surgery we do for a herniated disc, a piece of disc hitting a nerve, where you can go and do a little opening and take pressure off a nerve. With a fracture, which is a broken bone, if it's still painful after 3 years, there's probably some chronic instability there, maybe chronic inflammation. There is a less invasive procedure called vertebroplasty, which is a fancy way of saying put some cement in the bone to support it. She might be a candidate for that, but given that this is going on for 3 years, that would have to be evaluated with an MRI and maybe a bone scan. But for fractures that are causing chronic pain, oftentimes you need a more reconstructive surgery with a removal of the fracture and replacement with screws and rods in a cage to support the spine. That's called a spinal fusion. That's not done through a 1-inch incision. That's more of a major surgery.
Okay, and if you have any questions, you can always reach out to Dr. McCance for a second opinion. I think it's worth your time. Now, as you know, age is one of those risk factors that we spoke about, and people are going to their 70s and 80s and 90s, and we're dealing with arthritis, osteoporosis, and all of those are also risk factors that's involved with back pain. There's another very good question that came. I believe it's a patient from California that talks about, the effect of arthritis and how that kind of lead to this back pain. Maybe we can put up the question and we can talk about it. She is suffering from arthritis, and over the time, she has severe back pain. What do we tell those patients that have arthritic issues?
Another big problem, as we age with the normal loading of the spine and the wear and tear, the joints in the back oftentimes become arthritic. These joints that move in the back, called the facets, the disc can become arthritic, and that can lead to chronic back pain. Sometimes the arthritis gets so large that it chokes off the spinal canal and causes spinal stenosis. That's relieved with injections in the back and therapy or with surgery. Other patients just have arthritic pain from the joints itself. We usually advise swimming, Pilates, core strengthening, Motrin or Advil, visits with a chiropractor or physical therapy. We don't typically operate on general arthritis of the back.
But I got to tell you, Sean, a lot of times, and including my own mom, went for epidural injections.
Yeah.
They get a very short relief from that, and then all of a sudden, 4 months later, 3 months later, it's back. Mm-hmm. She actually went for 2 or 3 of these injections, and you get a. I'm not saying epidural is not good for you, but there's certain room for it, but a lot of times these are not cure. Is that fair to say?
That's fair to say. What the epidural does is, through a small needle, we put a little cortisone and medicine into the spinal canal. What it's very good at is taking inflammation away from a nerve. So if you have a nerve that's pinched and swollen from a piece of herniated disc, it can calm that pain down very nicely. However, it doesn't fix anything, so the pain can come back. If the disc doesn't shrink and go away, the pain will come back. In the case of arthritis, the epidural does not fix the arthritis. It temporarily takes away inflammation. You feel better, but inevitably the inflammation comes back and the back pain returns.
Okay. Now, let's talk about the scoliosis, because scoliosis, obviously, some of you had questions that also can lead to back pain. We have an image of what exactly scoliosis looks like and some of the treatments that you do to fix this problem.
Mm-hmm. So scoliosis is another common cause of back pain. About 5% of the population has a minor degree of scoliosis. As we age, sometimes the scoliosis worsens. With scoliosis, what can happen, again, we're supposed to be perfectly aligned in the front and the side. With scoliosis, the spine bends. That bending leads to a lot of muscle tension on the side of the convexity and a lot of arthritis on the concavity, where the bones have to carry extra load. So we're not designed to be off-center.
So are there braces that people can wear to kind of align this?
There are. Braces work.
And what is the success rate of that?
So if you have a child who's growing and they have a type of scoliosis called idiopathic scoliosis, where as they grow, their spine is bending, that can be treated very well with a brace. And with a well-fitted brace, it can reduce the scoliosis and help them to grow straight, and that's actually been shown to sometimes avoid surgery. So bracing is very effective in the younger growing spine. Once you've grown, and now you're 40 and you have a spine like this, a brace will only support you while you're in it, but you're going to go back to that position. It doesn't change the scoliosis. However, you might feel better while you're in the brace.
I see.
The problem with long-term bracing is that the muscles get weak. If you're wearing a brace all day, eventually your muscles start to get deconditioned. And when you come out of the brace, your body can't support your spine as it should. So it's a mixed bag for the adult.
So tell us about some of these surgical treatments that you do for scoliosis. And I think you have brought, I don't know if this is the one that you are referring to, but tell our viewers exactly what kind of surgery you do to stabilize this.
Yeah, so with scoliosis, if we end up doing surgery, the goal is to realign the spine, get it into a better posture, and then fuse it in that position so it stays there. So this is just showing a mini example of putting screws and rods into the back. What these screws and rods are, you can think of them almost like an internal brace, which is holding the spine in a good position. So if your spine is bent, and we can put a straight rod in and correct it, we can hold it in that position. And then we do a bone grafting technique to allow the bones to grow together in that new position. And after about 3 to 6 months, the bones are solidly fused together. They stay that way. You don't really need the screws and rods anymore because they've done their job, but we leave them in. We don't take them out. They essentially become part of the spine.
Sean, is there any issue with mobility once you do this, or it's just a short period of recovery and then they kind of become normal?
Right. So mobility issues are really a function of how many vertebrae are fused and what part of the spine is fused. For example, there's some professional golfers who've had their thoracic spine fused and golf very well because we haven't fused the lumbar. If you have to fuse the lumbar spine, if you have to fuse the entire lumbar spine, there'll be some loss of rotation and side bending.
Mm-hmm. Okay. So there's really no limit of how many vertebrae you can put together.
Correct.
And this is a long-term, the recovery from this is easy, hard? Is there a lot of physical therapy involved with this, or patients do well?
So for bigger scoliosis surgeries, we usually say there's about a 3-month recovery period, but during that time they're walking, they're getting back to work, they're doing physical therapy. It takes 3 months for the bones to heal together, and then 6 months to be considered fully rehabilitated in terms of returning to full activity.
Okay. Any surgical treatment for lower back pain that you want to talk about now? Or we
Sure.
covered that?
Yep. A quick word about lower back pain. Most low back pain is non-operative and treated with the things we discussed. However, there's a segment of the population who have years of chronic back pain and live with chronic back pain. And those patients can be helped very well with surgery. Usually what's driving that pain is degenerative disc disease and microinstability. And after a very careful analysis and workup, we typically do targeted surgeries at those couple of discs that are causing the trouble. And about 90-95% of those patients have excellent pain relief.
And what does it involve? It's a incision, they come in, tell us exactly what happens. It's a same day, do they stay in the hospital?
So for that surgery, there are some surgeries we do that are same day, which are more microscopic surgeries. For the back pain surgery, typically there's an overnight stay because there's some incisions and reconstructive work which have to be done with disc replacement and screws and rods and things of that nature.
And are you recommending like any kind of laser treatment for some of these herniated discs, or is that still part of experimental approach?
Yeah, laser is nothing more than a device that delivers heat. There's a small segment of types of herniations that can be shrunk by a heat, but laser, quite frankly, is more of a marketing tool than a reality in terms of surgical reconstruction.
Good, well said. Okay, now, obviously this was a big topic and we wanted to cover this, but I think a lot of times one of the issues that I sometimes have from just like leaning and reading and studying and constantly like doing your charts and everything is back pain, which is like a cervical issue that you may have. Mm-hmm. And that's, the population in U.S. probably have more lower back pain than cervical, obviously, right? Statistic-wise. Do you see more lumbar and thoracic than cervical?
Yeah, so it's almost a 3-to-1 ratio. About 75% of the population will have lower back issues, 25% will have neck issues in that group.
So when somebody comes to you with neck pain, what are some of the diagnostic tools? What are some of the risk factors? How do you basically go to diagnose them?
Sure. So when people come in with neck pain, again, it depends on how long and what's the cause. You know, if someone was in a car and they got rear-ended and they have acute neck pain, that's called whiplash. We know from natural history studies that usually goes away in about 6 weeks' time. If you were to do an MRI, you might see muscle inflammation or tendon inflammation. Most of those patients get better with Advil and a little physical therapy. If the neck pain has been going on for longer than 3 months to 6 months, we start getting worried about more structural issues. And the key trigger that leads to more imaging is if the pain is going down the arm, shooting down the shoulder blade, causing numbness or weakness. Then we get concerned that it's not just muscular or arthritic neck pain, but disc compression on a nerve. And that's the red flag to do a further workup.
And is MRI the best test that we use to diagnose these cervical images and herniated discs?
It is. MRI allows us to look inside the body. There's no radiation. It's all magnets. And it allows us to see the discs, the nerve, the spinal cord, and it's the most definitive way to evaluate these issues.
Now, one of the reasons why this is important, because if you look at some of the images that the nerve innervation that comes from the cervix, actually, whatever comes from neck would affect all the lower part of your body. So starting from your arms and all the way down to your lower extremities. In my field, obviously, Sean, we see a lot of these lower back pains with the S1, S2, S3s that can affect the bladder. Sometimes it causes like incontinence, bowel issues, etc. But I think with neck pain, you would see more of arms and legs and the lower extremities. Show us some of the anatomy of the cervix, and I want you to describe exactly what's going on and how this is different than the lower back.
Sure. So you're exactly right. Pressure in the neck from a disc can hit a nerve in the neck that will cause pain down the arm into the thumb or the hand. Pressure on the spinal cord can affect the whole body.
Right.
So there's a differentiation between a disc that's hitting a nerve or a disc that's hitting the spinal cord. If the disc is hitting the spinal cord in a severe way, it can even lead to leg dysfunction, imbalance, leg weakness, bladder dysfunction in severe cases. So that's a differentiation that we look at.
Any vascular issues, like if you have any carotid problems or you don't have enough blood flow to the area, that can be similar to like neck pain that people need to worry about and not ignore?
Very rare. That's more likely to cause a brain issue than a cervical spine issue. That would be very rare.
Okay.
But the neck is a little bit of a mini lower back in the sense that, actually this is probably better. The discs are smaller. Instead of being curved like that, the neck tends to be curved, well, similarly, more neutral or lordotic. The spinal cord is in the spinal canal. The discs are in the front. The joints are in the back. And either the disc, the most common issue is the disc from the front pushing backwards, hitting the nerve of the spinal cord. The spinal cord sits in the middle of the spinal canal like that. And anything from the front, a piece of disc that pushes to the back, can impinge on the spinal cord or a nerve and cause the issues we talked about.
That's as a result of just chronic pressure, or is it from like trauma, or what exactly causes it? Why would the disc start moving from front to the back and press on that nerve? Or is it just from like just bad posture or like
It's multifactorial. The occasional patient who has a trauma from a fall might have or a car accident might herniate that way. But much more common is just the wear and tear of daily life. Genetics is a huge factor. Some people are more prone to herniations than others. Many of my patients have family members, siblings, or parents that have had a herniation. Someone who played sports when they're younger, maybe they played football or did gymnastics and took a lot of repetitive trauma to the head and neck without realizing it, just micro injuries that ultimately when they're 30 or 40 manifest as a herniation. Realize. So things can build up over time. The postural issues and the body weight issues more affect the lower back. With the neck, it's more genetics and wear and tear.
Now, this poor guy is in deep trouble. I've been playing with his spine for a while. I don't know if I broke this or not, but you've been fixing some of this like cervical stuff. Explain to us, is this a very similar operation as you do with the lumbar and lower back, or a little different?
So there's a few different surgeries we do in the neck. Can you hear me, that little one there?
This guy?
The second one. More commonly, we end up doing most neck surgery from the front because the disc is in the front. So we'll actually come into the neck, we'll take out the disc. That allows us to look at the spinal cord and take any pressure off the spinal cord, and then we replace it with an implant that takes the place of the disc. And that allows us to decompress and stabilize the cervical spine and most importantly, relieve the nerve pain.
Now, the new discs that you guys replaced it, what is it made out of?
Well, there's different types of implants.
See, I'm learning also. It's not just for the patients. I'm actually learning a lot myself. So what do you replace them with?
So there's different types of implants. We use a combination, quite often titanium implants. They can actually integrate with the bone and join the bone. There's new technologies, plasma spray technologies, and even 3D printing technologies that allow the implant or the cage to integrate with the bone and heal with the bone. And then there's metal plastic parts for disc replacement, where you can create a mobile situation where it imitates some of the normal motion of the disc.
And how long does it last? Is it the number of years, or do they need to be replaced? Or
so if we implant a cage device and fuse the space, once it's fused, that lasts a lifetime. It doesn't need to be replaced. With the newer technologies and disc replacement technology, we don't know enough about them yet in terms of the mobile bearing, how long that will last. We know in the hip and knee literature that 15 to 20 years is the lifespan. We'll see in the neck how it plays out over the next 10 to 20 years. I just want to show a couple of things that I picked. You know, certainly in the work environment and the workplace, we sit for so many hours. And I think one of the things we spoke about was like standing desk. I don't know how you feel about this, whether there's any truth to this, but I think even getting up and doing your work, that may relieve some of the pain that you may have on your back. Yeah. And I also told my office to buy this for me. They were laughing all about this, but maybe once a day I can basically get on my head to relieve some of the stress that I have. Does this work? What do you think about this? Is it a good idea, bad idea? You showed two pictures. When you sit, all of your body weight is resting on your discs, and you're not engaging your muscles. When you stand, you're engaging your core, your glutes, your hamstrings, and taking the weight of your body off of your spine. That's why the standing desk works, or the partial standing sitting where you use your knees to support your body weight helps. And then the inversion table that you showed, what that's doing is by hanging upside down, your body weight is stretching, and that's relieving muscle spasm. and maybe taking some pressure off the discs while you're in that position.
Good. So, the time went by really fast, John. We certainly learned a lot from you, and it's a pleasure and honor to have you here. For anyone that wants to get in touch with Dr. Sean McCance, go to drsamaditv.com and send your information, and we'll pass it on to him. The bottom line is healthy nutrition and diet, which we didn't get really to talk about, antioxidants, making sure that you have enough blood flow to these discs, good posture, making sure that you are losing weight and keep your weight in order, and exercise. All of those play a big role. And again, having a great doctor like Dr. McCance is always helpful. Pleasure to be with you. We'll see you again next Sunday for another half hour of medical education. Thank you for being with us on Sunday, and we'll see you soon. Be well.